It's 11:12. You are listening to the Mid-Morning Talk on Salam Media. Oversized breasts or pathological breast hypertrophy can cause a variety of symptoms, including shoulder pain, muscle spasms of the shoulder girdle, headaches, skin rashes underneath the breasts, pins and needles in the arms, and postural problems. For many women with oversized breasts, health problems uh, are not their only challenge, and wanting to undergo breast surgery is an added challenge. Joining me right now to talk about these challenges is Olita Khuboni from Breast Reduction Support South Africa. Good morning, Olita, and thank you for joining me.
Good morning, Mariam. Thanks for having me.
All right, now, let's just go straight into the challenges. What are they, especially for the women who want to undergo a surgery, breast reduction surgery?
Mhm. Over and above the physical challenges that you've already mentioned, your back pain, shoulder pain, headaches. Many women suffer from headaches, and one of the more severe ones is where the weight from the heavy breast actually affects the spinal cord. Some
Mm.
of them find that even the posture changes because of this heavy load that they are carrying. And over and above those physical effects is psychological effects as well. Because for many women, especially young women with a big breast, you find that it affects them socially, it affects them emotionally, because finding a simple thing as somebody walking into a retail store to purchase a bra, it's a psychological torture because the sizes are not there. For somebody who's wearing a bra size, cup size K, finding a bra is almost mission impossible. And that also brings with itself financial challenges as well, because for a proper bra you can pay anything from 1,000 rand going up. So these are all the challenges that many women across the globe are suffering with.
Wow. I mean, you would never think that spinal pain or spinal challenges could add to that. And we all know that anything that has to do with your spine could leave one paralyzed. So imagine carrying
True.
this heavy load for a long time. Now, why is a
Mhm.
breast reduction surgery not considered, or rather, how is breast reduction not cosmetic surgery?
Okay, breast reduction is not a cosmetic surgery, because for many women in our support group whom we have come across, it
Mhm.
goes beyond aesthetics. It goes beyond them wanting to look good. It is because of these things that I've just mentioned now. And a lot of them
Mhm.
find that you go, people are on medical aid, you go to your medical aid and they straight out decline it. In fact, it is listed as cosmetic surgery by the Council of Medical Services for all the medical aids that are in South Africa. You will find that some of them it's only on the highest option, where they will even fund a portion, maybe 70% or 80% of the breast reduction surgery,
Mhm.
which is also a very minimal amount, because you find that for breast surgery alone, you're looking at anything from 60,000 going up, depending on how big they are and what the doctor plans on doing. So it goes beyond aesthetics. As I've said, it goes beyond what people see. It goes deeper into the psyche of a woman who on a normal day to day have to struggle. We have women in our group who on a daily basis they have to wear two bras just to look, to have comfort of at least something is holding your bra, because not all of us can afford to buy a bra that costs 1,200 rand to get a proper fit. So this is where we're standing, and this is where we are saying breast reduction is not cosmetics. It goes far deeper and far beyond cosmetics.
So are you saying
Mm.
that there's not even a single medical aid that is willing to look into this and to cover a breast reduction not as cosmetic surgery?
Okay, as I've mentioned, in our group we shared a list. We went around with some of the ladies that I'm part of the administrators of the group. There is a
Mhm.
few very few medical aids that will give a portion. None of the medical aids cover 100%. So we are looking for, let's take somebody who is your middle income earner, and the code for the breast reduction is 65,000, and your medical aid says we are only going to cover 80% of that. They still need to come up with the 20%. And with the financial climate in our country, not all of us have 20, 30,000 stashed somewhere waiting for you to pay in. So what we are trying to make the medical aid, or in fact the Council of Medical Schemes, aware of is that many women are suffering physically. There's a lot of women that are overweight because going to the gym is mission impossible with big breasts. There are women that are wearing size K, cup size, and above. So the weight makes it impossible for you to even exercise. So they are overweight. So there's a lot, and the overweight, the high BMIs brings with it other conditions, your high blood pressures, your sugar diabetes, kidney problems, a lot of other conditions that are now related to this. So it would actually be a good idea for all the medical aids to cover it fully, because not everybody has money to pay in for this procedure.
True. I mean, we must not forget that there are people who with low income earners, not just middle class, and how are they supposed to afford a surgery that costs 65,000? Then it brings me to the next question: is this procedure available at public hospitals, and if so, does it come at a price, or is it free?
Okay, it is definitely available in our public hospitals, our public facilities. So now they use a criteria where they check the income. For your students and people that don't have an income at all, they can get it for free. And just to give an example, I'm in the Johannesburg area. Your hospitals like Helen Joseph, which is not too far, when you are maybe working and can afford, they charge you 26,000. But for somebody who earns 3,500 rand a month, 26,000 is still a lot of money. And to be on the waiting list for the free breast reduction, you can wait for up to 2 years or even more, because the list is so long.
So it's like you might as well just save up that 26,000 in order to get the surgery done. Wow.
If you have an income that allows you to save, I mean, I classify myself as a middle income, and I cannot save for 62,000 rand. It's impossible, not with the financial climate that we find in our country currently.
Exactly. Now, what happens during the breast reduction surgery? If you can just take us through that a little bit.
Okay. So basically, to walk you through, obviously, let me start. The doctor will then consult with the patient, and then they will work out how much tissue needs to be removed. And on the day of the surgery, the doctor will make markings on the breast where they are going to make incisions and remove the breast tissue. So the extra breast tissue gets removed. And firstly, they will remove even the nipple, put it aside, remove the additional or extra breast tissue. Thereafter, they will then close up and then sew back or stitch back the nipple area. And then that's how now they make sure that the breasts are reduced in size.
And how can one prepare for this surgery?
Okay, let's start with the psychological preparation, because this is major surgery. It is with all surgeries there are risks. So what we also do in our group is that we share all these risks, the possible risks. So depending on where the person is, if it's somebody who's got comorbidities, your diabetes, your high blood pressure, and all of that, we always advise the ladies to make sure that all of these are controlled, and they consult with their physicians to make sure that everything is under control. And if there are any other conditions that might affect the outcome of the surgery, we advise them to discuss this with the surgeon before surgery. And then we also advise them to prepare for when they come back, because after the surgery you will be in hospital for a day or two depending
Mm.
on your surgeon's preference. Then we also ask them to prepare for when they get home, because you are literally incapacitated when you get home. So there needs to be support. You need somebody that will help you to wash yourself, help you to dress, and all of that. And we always advise the ladies to make sure that they get post-op or post-surgery bras that will give support, because now the breasts are still new. They will need a support to make sure that they fall properly into shape and size. And yeah, so basically is physically making sure that you are physically well, emotionally preparing yourself, because this is an emotional turmoil. We also give information for after the operation, because as we all know, we are different as people. It's not all of us that will recover as prescribed in the textbooks. Some people might get infections, and we share information on how to deal with your wounds if you get infected. Some might struggle to come out of anesthesia after the surgery. So we prepare the ladies with all of those possible negative effects of the operation. But also we also advise them to prepare mentally for the new you, because you
Mm.
used to buy this double XL tops to make sure that you accommodate your old breast. So after the surgery, your clothes don't fit you anymore. So you need to prepare for that as well. So this is all the information that we make sure that we share in our platform.
Hmm. And well, again, it comes down to the costs of things, because now that you used to have this wardrobe and you have to change your wardrobe again because now you have clothes that fit you and you want to
Yeah,
buy new items, etc. Hey, everything costs money these days. It's all about money.
exactly. So and like you now obviously can see, well, somebody put themselves through all of this just to look good in the eye of the people. So this is why
Mm.
we're saying this is definitely not cosmetic.
Mm-hmm. All right. Now,
Mm.
what has been the success rate of breast reduction in South Africa?
Currently, I think we've got quite a number of very good sessions in our
Mhm.
platform. We have a few of them that contribute. We host information sessions with them where the ladies can ask questions to the doctors. So with the information that we get or the feedback that we get from our doctors, the success rate is quite high.
All right. Well, that's great to know. It's just unfortunately we're still struggling with the costing of the procedure.
Yes. Yes.
What would you like medical aids to know about your breast reduction and in South Africa more specifically? Because I read an article
Mm.
somewhere where a lady said she actually got her surgery done in France for free.
Mm. Yes. Yeah, many women. I mean, even not even your Europe countries. There are many women that are now traveling to Botswana, to Lesotho, because at least it's a bit cheaper there. But in South
Mm.
Africa, it's still very much expensive. The one thing that is at the top of our list is for medical aid or medical aids to come to an understanding that this is not a cosmetic, and it needs to be funded fully by the medical aid. Of course, we do understand that there are criteria that are that still needs to qualify according to what levels do they consider to be a valid reason to get aid. They can do all those things to protect themselves, because I understand that it's a financial industry as well. So they can't just
Mhm.
approve everything, but they need to come to a space where they give guidelines to say anybody that falls within these brackets can get full funding, not this part funding and then you still need to go and get money somewhere. So they can still put in the measures to say these are the qualifying criteria, and allow the ladies and the surgeons to work and make sure that only those that actually qualify do qualify and get the funding that is so much needed.
Right. And we've also
Mm.
seen an increase in medical insurance companies. What do you think? Should they also include such surgeries within their packages?
It would be nice. It would be nice. However, with the market or the landscape of the medical health funding scope is concerned, for them, you might find that they mainly look at your basic medical needs. So for them,
Mm.
it might still be a challenge when it comes to funding, because even the number of their clientele,
Yeah.
I don't think they will make enough money to fund for everybody. But those that are big enough to can afford it, I don't see a reason why not.
Mhm. All right, Olita, how can people find your group and be part of it for those who are interested in getting more information?
Okay, we are on Facebook and on Twitter. It is Breast Reduction Support Group South Africa. So both on those platforms, we are on Twitter, we are on Facebook, and because of the nature of the information that we share in that group, we are very strict in admitting people into the group. So there is a few questions that anybody that intends to go in needs to answer, and make sure that they answer truthfully, because we do make sure that we scan, because everybody that's in that group becomes vulnerable and they bear their all in the public space. So we make sure that it's a protected community. And on that same breath, I want to also say that that is why we also are very strict when it comes to the contributions that people make. If we find anybody maybe not taking care of someone's emotions and all of that, we are quickly to remove people from the group, because we want it to remain a safe space where people feel safe to be vulnerable and have people that care enough to walk them through the journey.
Mm-hmm. All right, that makes sense. Thank you so much for your time, Olita, and for sharing that information with us.
Thank you very much for having me. Thank you.
That was Olita Khuboni, an admin for the Breast Reduction Support Group South Africa. You can find them on Facebook and Twitter should you require more information, or if you would like to share your challenges as well regarding pathological breast hypertrophy. If you would like to undergo breast reduction surgery, well, I didn't know that countries like France have it free, so you just have to pay a return ticket, a hotel, etc., and go and get your surgery done in the Europes, or even closer to home, where it's even more affordable in countries such as Botswana, like Olita mentioned. But yeah, I think it's about time that people come together, sign petitions, and to encourage medical aids to do something about this. It's so much that needs to be included, and they're taking advantage of that. Anyways, it is 11:30. You are listening to the Mid Morning Talk on Islam Media. We will be right back.